Hey everyone, Phil Plisky here. Today I want to talk to you about the multi-segmental extension pattern from the SFMA. This is a really important pattern. We see this to be dysfunctional and painful in a lot of people. A lot of people, when they bend backwards, have low back pain. So it's really important that we understand some of the nuances with this pattern. A couple of the things that we really look for are this anterior weight shift as well as smooth spinal curves. We should be getting proportional motion from each segment of the spine, but we don't always see that. A lot of times what we see is the person does an anterior weight shift and they get all their motion from this L5, S1 segment. We call it hinging. It's like this fulcrum right there that the person doesn't extend throughout their thoracic spine and not proportionally in their lumbar spine. So this is, what does this all mean? Well, a couple things. One, make sure you break out this dysfunctional painful pattern, because a lot of times you will see that the pain will actually go away when you go to lower level postures. And what does that tell us? Well, that means that we're dealing with more of a stability problem likely because we have this inconsistent finding, because we have pain in a top tier pattern, pain and dysfunction, but when we go to a lower pattern, if it becomes functional, non-painful, that's a stability problem right there. Well, as we remember, we're not just going to look at only top tier or just only one breakout. We're going to put the whole SFMA together. And that's where it's really important. We see this combination of hinging at the lumbar spine along with some unique findings in the multi-segmental flexion pattern. What we're supposed to see in the multi-segmental flexion pattern is this nice posterior weight shift, smooth spinal curves, again, that we're getting the motion proportionally from each segment. When we see this hinging, a lot of times what we'll see is that person can palm the floor. And if you're not paying attention to all the criteria of the top tier patterns, you might look, well, their multi-segmental flexion is totally fine because they can palm the floor. That's usually not the case. They usually don't reverse that lordosis, or they don't flex the spine the way they need to. They get all this motion from their hips. So what does that mean? Well, I'm going to be sure that I have the Beighton criteria on this person, because if someone can palm the floor and they have one of the other bilateral signs like hyperextended elbows or hyperextended knees or bringing the thumb to the forearm, if they have another one of those signs bilaterally, I'm definitely putting this person toward that stability bucket, which impacts my treatment. I'm going to have a little bit different treatment philosophy with this person, because a lot of times when I break them out and I get down to multi-segmental rolling, when they're doing a flexion rolling pattern, a lot of times they'll go into extension to do that flexion pattern. This is where they get their stability. This is why they hinge at that segment. They are getting all their stability in a lumbar extended position and really don't know how to be stable when they're trying to do a flexion activity. Well, no wonder the back gets pissed off. Well, so what are we going to do from a treatment philosophy? With each of our reset, reinforcement, and retraining techniques, we're going to have to think about locking out that lumbar spine when we're doing things, because the body is going to take the path of least resistance. And right now that is at that L5, S1 segment. So if we try to work on hip extension with the person, that hip extension is actually going to come as in the form of lumbar extension unless we're very careful locking out the low back. So for example, if I want to work on an anterior superficial chain mobility problem, so that rectus femoris, I've got a trigger point in there and I want to work on that. I'm going to do some hold relax PNF. I'm going to want that person in a prone hip mobility position with that opposite knee up to their chest. That's going to tilt that pelvis posteriorly to get them into lumbar flexion while I work on that rectus femoris and then work on that hip extension. It's going to be so important. We need to do the same thing with the thoracic spine. So our manual therapy techniques need to consider that. When we get to our reinforcements and our retraining, we also have to consider that. When we're looking at multi-segmental rolling, remember that flexion rolling pattern, they tend to extend. Well, one way to combat that is to have them go into a hard rolling pattern where we're going to bring the knee to the elbow and have that engaged there. That's first of all going to posteriorly tilt that pelvis, get them into lumbar flexion, and it's going to lock them there. It's going to engage that core. So now we can retrain that pattern so that we have this authentic flexion stabilized pattern Remember, because of that hinging at that L5-S1 segment. If you all have any questions or comments, please leave them below. We love to have that interaction, that engagement. We want to hear from you.
Hey guys, if you like the video, definitely hit the thumbs up. And if you want to stay informed, hit the bell so we can notify you anytime we put up new videos. And of course, any questions or comments, put those at the end. We'll certainly be checking them out and trying to respond. Thanks so much. And remember, always move well and then move often.